Guys, so we are not live yet.
No.
Okay, we are live now, and we have a guest today. Hey Varun.
Hi.
So Varun, just tell us about yourself. What do you do?
Actually, I am Dr. Varun, and I have done my sports medicine, DSM, and I have done MD. Then right now I am working in AIMS.
Okay.
As a senior resident in physiology department.
Okay. Your martial arts background. And stuff.
Yeah. I was in Taekwondo.
Okay.
In WTF style Taekwondo. So I was practicing Taekwondo also sometimes.
Okay.
And in Thang Tha also.
Okay.
Thang Tha is a traditional martial art of Manipur.
Excellent. We need to learn that.
It's a weapon based,
Right.
sword and
Right.
all this thing. So fitness and all this thing.
Excellent. So you're a
That's my
practitioner. You're a practitioner before preaching.
Yeah.
Excellent.
It's something like that.
Right. So people who are new to this Facebook Live, what we'll do is we'll have 3 parts, and Varun again same for you. So we will discuss recent research that's come out in last week or so, and how is it applicable to the common man, the patient, if it were.
Okay, that's good.
So we'll have two things to talk about.
Yeah.
Then we'll be talking about a couple of cases. Again, that's something that has happened in the last couple of weeks, which is relevant to people. Okay. And third is basically taking on cases. Question and answers.
Okay.
So some have already come. Some that will come now. We'll just take it on as it comes. Okay. And probably it's a good idea that different opinions.
Yeah.
So it'll always be good. Yes, exactly. So the first one is. There's a very interesting study that's come out about total knee replacement.
Yeah.
Okay. My simple.
Very common nowadays.
Very common nowadays.
Especially in India.
Yeah.
Especially in females, with this increasing obesity is very much high because of that.
Yeah.
So nowadays very common. Bread and butter. No.
So I'm not the only one who says that.
Yeah.
Okay. So the study was about total knee replacements being done in obese people, and it was done over 2006 to 2016. So over 10 years it was done.
Okay, 10 years study.
That's right.
Okay.
And there were 126 people that were looked at.
Sample size good, 126.
That's
for 10 years.
Yes,
okay.
Exactly.
Yeah.
And then they were saying people who are obese, there was a higher chance of getting it done at a younger age.
Okay.
Okay, so there was this thing about if you're obese, you end up
these
getting a
are the
TKR.
people who are diagnosed osteoarthritis.
Yes.
Diagnosed case.
Yes. Yeah. Okay.
So it's not a surprising study. Obesity is directly related with degree of progression of osteoarthritis. In fact, it is also one of the important modifiable factor for risk factor. Risk factor for osteoarthritis.
Totally.
So this is not a surprising study. Yeah.
They were,
up to now.
Yeah. They were taking it further. They were basically saying people who are not obese, their results have been better over the 10 years. Again, nothing new really to us.
Yeah.
But how should they do then if someone is obese? If they're getting a knee replacement, what should we do? Are we saying then they should be losing weight?
One more thing. Do they compare the complication rates also after TKR? Something like that?
There was. No, I don't know the numbers right now, but yes, they were. And but this particular study wasn't so much about. It was over a 10-year thing. They were not looking at the complications. They were just saying over the 10 years, who has the pain yet again versus who doesn't. Quality of life. Functionality. It was about primarily functionality.
Okay, clear.
Right? And their basic assumption is, it's not an assumption, it's basically proven by the research that if you were not overweight, your results were better. So now they're suggesting go lose weight before surgery.
बिल्कुल सही है. Obesity, even just before starting of osteoarthritis also, obesity is an important risk factor. So one has to reduce it.
Right.
So that's very important. And in fact, from this study, we can say that the quality of life improves. And one more thing is there is what you call danger sign or something like that. Being obese, the time of surgery, the time at which surgery was prescribed, that means the severity. The severity is very much at a very early age.
Yeah.
That means the quality of life is so much reduced because of obesity.
Yes.
So for general people, there's one more, reason to walk out.
Totally. But my question,
sure, please.
My question is basically, if someone is obese, has knees very bad, which are being recommended TKR for, How do they lose weight?
First, because the knee is having already osteoarthritis. So they can increase in physical activity is number 1 point. Physical activity can be increased by having what we call non-weight bearing first. Non-weight bearing exercise like cycling can be limited. Cycling can be swimming is a very good option here.
Right.
Because what we want is we just want to reduce the pain. The importance of pain is that pain has an inhibition factor over the muscles.
Right.
So pain has to be reduced. Only after reduction of pain, then we can properly, the muscle can be strengthened. Okay. And another point about this osteoarthritis and also they are degenerative disease. So chronic degenerative, we can only modify it. So 100% cure is difficult. Okay. So that can only be done by improving the muscle, because muscle is the important role, a protective role. Okay. The muscle has to be developed. Okay. And for all the muscles like the muscles around the knee joint as well as around the hip joint also, it can be developed. You may go into the core also, something like that. Because recently one study come where the core strength and core stability is directly proportional to the reduced risk of the lower limb injury. In general sense. So all over fitness is very important.
Okay.
Here they can add. Talking more about the fitness. Fitness has a major component. Like it can be divided into 2 components. It is health related and skill related. Skill related is somewhat related to players.
Right.
So regarding the health related, we can say cardiorespiratory fitness they can develop to reduce the fatigue and all this. Right. Generally talking.
Right.
But muscular endurance and muscular strength is what we have to focus.
How would you do muscular strength?
What muscular strength can be it can be prescribed where the pain pain should be the limiting factor here.
Okay.
So depending upon the intensity of the pain,
okay.
So we can slowly introduce the first we can introduce the isometric the exercise can be introduced first.
Okay. So when you say isometric again, because we're talking to
common people. Yeah.
What isometric?
So simple isometric exercise is something exercise in talking in a scientific manner is exercise where the length doesn't change.
Yeah.
Here. Yeah. So this isometric exercise of the quadricep is very important. Like lying down in a simple starting from lying down in a supine, lying down flat in a, then we can raise the knee joint straight like that, and we can hold it for some time. Right. So it's become the isometric exercise for the quadricep here.
Right.
So it can be done for so quadricep starting from the isometric exercise. Right. Then slowly, depending upon the functional limiting factor of the pain, we can go to the concentric exercise like a knee curl and all these things. Right. So that can be done.
Right.
So if the OA grade is very mild, moderate or something like that, then we can further grow on to more a percentage of 1 RM we can achieve.
Excellent. So what about brilliant? And what about the rest of the body? What about other exercises?
Yes.
You said about core.
Yes. Right? Core exercises is very important. Like simple the praying can be done like the Bartok exercise, the Superman wala. So all that simple like physio ball exercise can be done. So and for elderly, elderly here the frequency of fall, reduction of frequency of fall is also very important. So proprioceptive exercise can be added upon this.
Excellent. So what you're suggesting is strength training.
Yes, strength training is very important. Actually, the concept among the general people, general person is fitness. We only mean cardiorespiratory fitness.
Totally.
Like walking and walking and jogging and all these things. Strength training we always neglect. So that's something which I want to address here. Strength training is very important. Even not talking about OA, but general strength training. One study just now. It was simple strength training, hand grip exercise. Hand grip strength. The strength of the hand grip is inversely related to the motility and morbidity.
Simply
all
that.
Course. Yes,
simply that. Yes.
Simply. So simply hand grip exercise it can also be prescribed for the reduction of the hypertension. So strength training is very important, not only for OA. For various all cause mortality and morbidity.
Excellent.
हर चीज के लिए.
बिल्कुल. Age wise, what is in your opinion? What age is too young or too old to strength train?
Too young, too old is something like that. Strength is always there. So there is no question of too young. We We are on the Earth. Gravity is acting upon us. So if you go to the higher, like spacecraft or something like that, then you can prescribe. But here, strength training is starting from the day we are born here.
Very good, thank you.
Yeah, we are acting against the gravity.
Yeah.
so strength training is there. There is no concept of the too young or something like that. But one thing, for younger age, specialization of the exercise should be delayed. You are doing again
general exercise.
Yeah, general exercise can be done.
Yeah.
But specialization in a particular sport, specific or something, it has to be reduced.
Yeah, perfect.
Because
what
young
about,
age.
What about elderly?
Elderly also. Yeah, elderly. The prescription by the exercise, like we can talk about SEMS or WHO like that. So
right.
The prescription by them is just like that. Strength training has to be done at least twice a week. At least.
Okay.
Twice a week.
Okay.
So this is what they prescribe. So those elderly who cannot, do all these things, they has to be active, as far as they can. So activity has to be maintained, but at least twice per week is what minimum prescribed. If you go higher, is good. So generally, the whole body exercise, like the whole body is grouped into different, like 6 or 7 groups, major muscles.
Yeah.
So exercise which are involving the major muscles, like the upper arm and lower limb, chest, and all these things. So if that can be done twice a week, that will be very fine.
Excellent. It's good to hear someone else say this, because I'm the only one that is saying all this.
Okay.
So that's good.
No,
there was a very interesting comment by a cardiologist, a very popular cardiologist from US, and this is a very old quote. This is like some 15 years old, and he was saying to stay out of the clinic.
Okay.
He said about the elderly, to stay alive, cardiovascular exercises are very important.
Yeah.
But to stay out of the clinic and the nursing homes, strength training is very important. And he's talking primarily elderly people.
Okay,
that's what he's talking about.
Okay.
And I think that's so important, because everyone just thinks exercises go for a walk. Okay, it does not stop there. Strength, as you're saying, twice, thrice a week minimum.
ACMS has prescribed, they define 6 type of health-related fitness. The first one is cardiorespiratory fitness, where our respiratory, cardiovascular system, fatigue and endurance relative is there. Then another is strength, muscular strength. Then another one is the relative, the body composition. Body composition, because nowadays people are going to the weight reduction. So it should be percentage fat reduction.
Right.
Lean body mass has to be maintained.
Right.
So it's not like that weight reduction. So body composition is there, muscular strength is there, muscular endurance is there.
Yeah.
So all these things make the proper fitness package. So we cannot selectively do cardiorespiratory fitness like that.
Yeah.
So it has to be combined.
Yeah. Now just taking it from like what you just said last, so nutrition part of how that affects obesity. So again, what do you have to say?
Yeah, nutrition. And if we are going into the recent advances like keto diet and all these things. Recent things. So. Earlier, for players especially, then I will talk about general.
Yeah.
For players, we always concentrate on carbohydrate, high carb.
Right.
Like, so recently, this has been replaced. Not replaced because conflicting results are coming up. So what they say that it has to be catered to a particular requirement or a particular subject. Like that, we cannot just go and prescribe high carb diet everywhere.
Right.
So just like in the general people also, there is misconception of like the high fat diet always causes high all these things. So my point, I am not selected to a particular theory, but I myself am a little bit going toward a negative effect of the high carb diet.
Right.
Just going.
Yeah.
So for general people, reduction of the carbohydrate.
Yeah.
And supplementation of the healthy fat. It can be essential fat.
Totally.
And all these things can be. Even for saturated fat also, the recent research are coming like that. Saturated fat are not that much bad after all. So and simple sugar is dangerous, huh? So research are coming about like simple sugars and all these things.
Yeah.
So my view is reduction of the simple carbohydrate.
And proteins?
Protein is must. Protein has to be there.
Yeah.
Protein is very much.
Yeah.
In fact, for a players, it's very much. But supplementation, that's I cannot talk. Taking proper balanced diet and proper food is more important than supplement.
That's the first medicine. Eat good diet.
Yes.
Eat food.
So it has to be food, no?
Yes.
Proper food.
Yes.
Like suppose some people are just drinking the juice and all this thing. So
right.
Eating the whole food is more good. Whole natural food.
Right.
Right. So that's more important than just refining and all these things. So
right.
that's totally right. It has to be natural.
Excellent.
And high protein is very important. Protein is very important.
Right.
And recently there is misconception like high protein diet causes the kidney disease and all this thing, chronic kidney failure and all. So the research has come up. Many research has come up. What they say is this high protein diet taking doesn't causes the chronic renal failure or kidney problem. Even for mild, if the person is having kidney problem, then a reduction may be done. But they're also mild.
Right.
So taking high protein is not an issue. It has to be, and carbohydrate has to be reduced until unless you are an endurance player or something like that, where you are going that carb loading concept was there earlier. So for a general people, for a fat reduction, weight reduction, so avoiding the simple sugar, number one, reduction of the carb, and supplementation with a healthy fat.
Yeah, excellent.
And protein is very
important. No, even in cardio endurance athletes, there's enough evidence today to say you don't even have to be on high carb even then.
Yes,
with fat.
The concept of the keto diet is coming. Because earlier what we thought that the carbohydrate is the one like that. No? But recently ketoacids, ketones, ketone body, very important. Ketone body, just imagine the fat, the amount of the energy released by the fat.
Precisely.
Very, very high as compared to carbohydrate and protein.
Yes.
So, and we have enormous store, and the fatigue in the endurance this event is mainly because of the availability of the resources. It's not like the accommodation of the fatty, what we call lactic acid and all that. That concept is gone. So that means we have such a big store of fat, and fat is the one which can release the ketones body, and ketones body are a source of fuel for brain. It can be used by the what we call heart muscles also. So very important for endurance player. They are saying, but one problem what they are saying is our body is not used to. After eating this high carb diet for a very long time.
Yes.
So one has to get to adapt. It may take around 2 to 3 weeks, something like that. So 2 to 3 weeks, your body may be having some problem, but after that you can go.
So don't do suddenly. Do it over a period of time. It's just like high carb to high protein. Just gradually.
It has to be gradual, and the person may suffer in the first part also 4 to 3 weeks. Just after that,
starts adapting.
Some adaptation will be there. For endurance, it may be there, but for what you call sprint and all this thing, anaerobic. The problem with the fat is the rate of energy release is limited as compared to carbohydrate.
Right. Okay. Yeah. So there's a very interesting piece that had come out. It was a tweet today early morning by India Spend, and what he does. This particular tweet handle, and basically they're looking for coming out with the latest research and all that, whether medical or otherwise. Okay. And they're basically talking about more women in India. 3 out of 10 women in India versus 2 out of 10 men in India.
Okay.
Basically don't take eggs, fish, chicken, or non-veg.
Fish is very important.
So point really being again, if the protein isn't there, the non-veg protein, the veg protein is not enough. So
obviously, high quality. Protein can be divided into high and low quality. Like the sources from the animals, they are high quality protein containing all the essential amino acid and all this thing. Going to biochemistry, basic biochemistry. So the people who are not taking, because India, this religious issue is there. So people who are not taking soya is a good sources. They can supplement with soya,
but not enough.
But not enough. Yes, right. Bilkul, but not enough. So in that case, it's very difficult to advise. So what to do? If medically, they can take like supplement powder and all these things which are made from the animal sources. Not taking the animal directly. So that kind of, if they are willing.
That's always an issue as well, right?
So that's a tricky one.
No, but again, recovery is slower if your diet is going to be low in protein.
Obviously,
that's connected.
Recovery has to be two types. I mean, just after exercise, recovery can be, I mean, the glycogen storage recovery, which is the basic recovery.
Yeah.
Another one is a protein, muscle building.
Right.
I mean, the muscle hypertrophy and all these things just because of the breakdown of the muscle during the exercise. It has to be recovered post-exercise.
Yeah.
So it has to be supplemented with this protein as well as carbohydrate.
Yeah.
So these two things has to be there.
Yeah.
It's not like that you just take the carbohydrate. Like
Totally.
Protein has to be there.
Yeah.
So those people who are not taking protein, then chemically we can supplement like branch chain amino acid or something like if they are willing.
Yeah.
Some branch chain amino acid that's leucine and that thing can be supplemented. HMB.
Right.
HMB. I mean generally prescribed for the bodybuilders and all these things.
Right.
So that can be, but again to the players, it's very tricky because you know what is there. Doping issue may be there.
Yeah.
Because we don't, even if the manufacturer doesn't write, that doesn't mean that it doesn't contain.
Yeah. Totally.
So that's dangerous.
Totally.
Yeah.
Now coming to a couple of cases, actually maybe we'll just take one of them. And this is about a gentleman, 80-plus-year-old gentleman who had come to me like a year. I've known him for a while, so he'd been coming on and off to me for 5-ish years or so.
Okay.
And with back pain, he used to come from I wouldn't even mention the state. So from further away, he used to come. He used to travel and be here in Delhi for a while. And finally, it was like he had low back pain because of listhesis, so fracture lower down. I mean, just in simple terms, of the the L5S1 region. Okay. So there was no instability.
Okay.
But the point is, eventually it was a lot of pain. He couldn't stand. He couldn't walk even 2 minutes.
Bowel and bladder was involved.
Totally good. No problem at all.
Oh, okay.
He was very active. He's a very active guy. Otherwise, lifestyle and all that stuff.
Okay.
So that wasn't an issue for him, right? But the point is, that was going on, and then we had referred him for other interventions, like whether injections or surgery or whatever, because we'd done it for a while. 6 odd months, there weren't much results as good as I wanted.
Okay.
And even after the injections, things didn't change.
Okay.
And then he moved to US, living with his family there, children and all that. And today morning there was a call saying, just to let you know, he's doing great and he hasn't had a surgery.
Oh.
And he's been very disciplined to do his exercises. He didn't want a surgery, so he's been well disciplined doing his exercises. Now, again, age, exercise, and something in medical terms, we think, oh my God, there's a fracture down there, and surgery is the only option. And he's improved, and at that age.
Oh. So what was his age?
80 plus.
80 plus. Okay. Okay, that's amazing. So exercise,
power of exercise.
Yeah. So same thing. I was. That's good. I mean, if you go into general public, I'm not saying against orthopedics or something like that. This practice of surgery, but many research.
You're polite. You're very polite.
Yeah, I mean, not like that. I mean, we have to talk the evidence-based medicine.
Totally.
Totally. Recently, many papers has come up saying that regarding the type of the investigation which has been done in back pain, like MRI and all these things, unnecessary.
Yes.
So many. And another is a surgical intervention also. Many research.
It's good to hear someone else say all this. Seriously, I mean.
Okay. Okay. I mean, I'm just talking about the recent research.
Yeah.
So
awesome.
It has to be from the research background.
Okay.
So surgical intervention also many things have come. The problem with the surgery, I mean, surgery has a very scope and many it's good overall.
Right.
But here the main focus was always for the anatomical problem.
Right.
Back pain is not an anatomical issue, not only an anatomical issue.
Right.
Back pain has a psychological effect also, so many things are going on. So just by reducing or just by taking care of anatomy, so we cannot just cure something.
Totally.
Everything is based upon anatomy. MRI is based upon anatomy.
Totally.
X-ray is based upon anatomy. Surgery is based upon anatomy. So, I mean,
and static anatomy. Not even functional.
Bilkul. Static anatomy.
Yeah.
So, something based upon only one aspect.
Yes.
It cannot solve the problem.
Yeah.
It has to be integrated approach.
Totally.
So, this is my view.
Awesome. And there was another case, we'll just briefly touch on it, but here's a case of someone having known psychological issues throughout, and having knee pains and back pains.
Okay.
But what was really fascinating for this, and this is a youngish gentleman, like early 30s, late 20s types, and whenever those things would happen, his psychological issues would like go up, his pain would go up.
Okay.
When he's otherwise feeling better with psychologically, his pains are less. And again, going to your point, it's not only about the physical itself, right? There's a mind there after all.
Obviously, pain. I mean, see, if we talk about physiology of pain, is a very complex subject. I mean, pain is just what we feel. I mean, it can be modified, it can be modulated at various level of the CNS.
Right.
So I mean,
CNS. What does CNS mean?
Oh, okay. Just like it. I mean,
central nervous
system at the level of the brain, at the level of the medulla, at the level of the spinal cord.
Right.
Modulation of the brain is pain can be done.
Right.
So pain has the pain is a output, final output. So many things come, then final output is pain. So it may be, the cause may be anything.
Right.
What you are saying is a what we call psychosomatic problem. Like if we are having psychological problem, the somatic problem is there, like pain in different bodies. So pain has a psychological component also. It has to be addressed. And that's very important. It has to be addressed. I mean, there should be integrated approach. Everything, especially regarding the pain.
Right.
So and exercise is a very good, important.
Of course it is. That was the main thing I gave to the guy. I told him go walk.
Yeah, obviously.
And go outside rather than on a treadmill.
Exercise has a what you call pain reducing effect.
Yes.
It has a good feeling effect.
Good
feeling hormone, endorphin, and all these things.
Yes.
Plus, exercise will, I mean, the body, the exercise will be improving all over the body, not only psychologically, physically, everything.
Right.
And the exercise is one of the approved treatment for depression also.
Right.
So depression, all this thing is approved exercise. Even exercise, exercise component has to be there for any psychological problem, including the chronic pain, like even for the cancer patient, research just come.
Yeah, we've been.
I was reading that thing. I mean, for each and everything, for cancer, this thing treatment, exercise component has to be there.
Yes.
Simple exercise.
Yes.
So starting from cardiorespiratory fitness and from strength training like hand grip, simple hand grip dynamometer, just
anyone can
one
do
small small machine and you can do hand grip and like 30 to 40% of the maximum. You can hold it. Isometric exercise.
Yeah, brilliant.
Very important.
Yeah. Let's go to questions and answers. So there was one question about if someone's running and running every day. I mean, that's the first part of the question.
Running every day.
Now, how bad or good is that?
See, running is a good. I mean, number one, general answer. So, and the intensity of the running and volume and all these things should depend upon the fitness level. It has to be, and it has to be slowly built up.
Right.
Slowly fill up. Just I was reading a few months ago. It comes like running causes, this back pain and all this thing. I mean, not causes. Why there is a myth like that. Myth. Like running causes osteoarthritis of knee.
Yes.
Running causes back pain and all this thing. So recent just study have come that the exercise, running exercise, improved the discs, hydration of the discs like that.
Of course it would.
So I mean, this just myth buster.
No, but it is. See, you're the martial arts guy. So basically, in karate or whatever, when you're breaking those things, right? It doesn't happen first day.
Obviously, it has to be developed. I mean,
exactly.
Our body here, the beauty of the physiology of the body is breaking and making is going simultaneously.
Precisely.
It has to be like that.
Yes.
So it has to be slowly. First, we have to break it. Then we have to build up. So
that's adaptation, isn't it?
Yeah, adaptation. Yeah, very important. And after sufficient adaptation, then you can do whatever you want. Your body will become a weapon.
Yes, exactly.
And this principle has to be applied in every exercise.
Right.
Be it running, be it strength training, be it anything. It has to be gradual, depending upon the body.
Yeah.
Otherwise, then if we go too quick, then overtraining syndrome and overuse this thing, the injury will happen.
Yeah.
If the body is not able to adapt.
Yeah.
In fact, for the players also, what the coaches and all this and what they are saying is just you have to train hard. You have to train hard in order to achieve that particular performance. But the problem is, training hard is not an issue. It has to be combined with recovery.
And even go gradually up. Don't just suddenly do it.
Yes.
As you said, overtraining suddenly.
Bilkul. So it has to be there. Gradual has to be there. In fact, the most common problem, what you call problem, is questions regarding running is, the famous barefoot wala. Barefoot running, the minimalistic shoes and all these things from the pronation, the supination, all this regarding that.
Yeah.
So the problem is if you have a pronated feet also, if you suddenly change like that, then problem will be.
Problem will come. Do it gradually.
Gradually, adaptation has to be there. And the problem where the people are not understanding is what we are seeing in the body is adaptation, secondary adaptation. The primary problem may be somewhere else.
Yes.
If the feet is like that, it may be because of the problem somewhere else. So if we reduce it, and if we are not addressing the primary problem, then we are creating more problem because the body try to adapt, na?
Of course.
So by doing like this, so that concept has to be there.
Okay, then what about running on tarmac, hard surface?
Hard surface are generally, traditionally, hard surface, it's not prescribed. It has to be through proper sports shoes or running on grass and all these things prescribed. So hard surface, what I say that first, if you are having some problem and like that, to hard surface, avoiding is traditionally as we can, but it has to be developed slowly.
Exactly. So just to add to this, if you're gradually doing it hard surface and you're landing soft, so one big tip to a runner: land soft. When you land soft,
I read the paper. Regarding this also, I read the paper.
Yes.
Yeah.
Yes. So you know what you do. What is the difference between us? You read. I kind of practice it.
Very nice. Very nice. That's a proper combination.
Totally. So the thing is, if you're landing soft, what happens is the pressure that's actually being applied. As you said about the hydration and all that. If you're landing with the impact, it's an issue.
The sound.
That's right.
Yeah.
So whereas too much emphasis has been about the heel and the mid and the forefoot. Just land soft.
Obviously.
Don't worry about where. One, it'll anyways be midfoot if you do that. But I think just start with that. So even a hard surface isn't too bad if it's soft landing.
Yes, obviously soft landing के लिए the intrinsic muscle of the foot has to be strong. It has to be strong. And the study just come, I don't know, maybe 6 months ago or something like that. One study just come regarding this also. Like what they measure, the vertical projection, the loading and the ground reaction force and all this thing. And what they find is very interesting. Like that, if soft landing is always associated with peak is reduced. So that's helpful.
So there's I'll share this. So there's a very interesting video I have of actually elephant and tigers and all that running.
Okay.
My own personal, so it's not from Nat Geo and all that.
Okay.
And the elephant was on a hard surface, which is Lutyens Delhi roads. Okay. And I was running and I kind of saw one and I was taking a video and all that. What was fascinating, while that elephant was actually doing stuff, so because we think about obesity and whatever after that, right? We started off with this conversation as well. You'll be surprised that elephant wasn't impacting heavy. It was super soft. It was going quick, but it was super soft landing.
Okay.
So point is, again, even if you are obese and all that, if you just keep it soft landing, you're already doing a big favor to yourself.
Obviously, it's a basic Newton's third law.
but people can't understand that, right? I mean, the basics are what they don't understand.
Yeah, if you give much force, then you will receive the much Newton's star, equal and opposite reaction. As simple as it is.
Exactly.
So,
you see, there's this question that had come to me previously, and then we'll take the live ones.
Okay.
So this chap had ACL sprain last year in right knee.
Grading, I mean totally.
I'll just read out his message.
Okay.
And while sprain was there, I did 2 half marathons. So it was only a sprain.
Okay.
And he, like any smart runner, did 2 marathons, half marathons. And that's very standard runner for, this is what I see on a regular basis.
Okay.
Because humans, what makes humans special is they never learn from other people's mistakes. They have to make the mistakes themselves. And then they try to learn from it. Okay, but it applies to you and me and everyone. Okay?
Very good.
And then within a span of a week, due to which the problem aggravated, he had to undergo 4 months of physiotherapy before starting to run again.
Okay.
And was doing strengthening exercise as well. Now, this January 2018, he was doing a 10-kilometer run, and the pain in the back also came along this time. Okay. And he stopped for 3 months and went to physiotherapy. Now, this is one big one for you.
Okay.
What he was doing in physiotherapy was ultrasound and diathermy. Okay? So again, we'll come to that in a minute.
Sure,
okay?
sure.
And then he started running again from 28th April, limiting himself to 2 to 3 kilometers, but sometimes pain still would persist.
Okay.
All right? And he then tried to do taping or getting taping done for the lower back by the physio or whatever. And then he's like, kindly suggest how do I start running and all that. Now, first point for you is physiotherapy, diathermy, and ultrasound.
See, diathermy and ultrasound, the result is conflicting in one sentence, I will say.
Okay.
I mean, the efficacy, the effectiveness, randomized control trial by using, randomly blind study. The result is, many people will be, opposed like that.
That's okay.
But still,
don't be polite. Just facts.
Okay, yeah. So factually, what we're saying, like ultrasound, kinesio taping, and all this thing, the result is conflicting. We cannot say. The evidence is not in our favor.
Yes.
So by using ultrasound and all these things is very difficult. He should have been, if he was having the ACL problem, then the strengthening exercise has to be done, like hamstring, especially hamstring is very important. Hamstring and the hip and all these things.
Yeah.
And regarding the back pain also, back pain maybe because of some other reason, it may be because of the secondary muscular imbalance may be there.
Yeah.
Because of the knee problem.
Right.
So that maybe we have to check the muscular imbalance.
Yeah.
So correcting of the muscular imbalance, and by correcting all these things, by doing a proper exercise, then he can come.
Let's go back to the last few words you used here. Okay.
Yeah.
What is physiotherapy in your head? What do you think what a physiotherapy is supposed to be?
Actually, I am not from a physiotherapy, so I cannot comment.
No, just the word. Just the word.
Word.
Physiotherapy.
Okay.
Physical therapy. It's
Yes,
physical therapy.
yes, physiotherapy.
So what does it mean?
We have to give the physical agent. Physical agent includes everything, like from exercise and all these things.
Yes.
So ideally, it should include.
Right.
The problem, what I see from nowadays here and there, they are using this electrotherapy.
Thank you. Thank you. So, I was wanting that.
Okay.
So basically, when ultrasound and diathermy and IFT and laser and all that, simple physical therapy. Two things to it. One is exercise, the physical from the patient side.
Okay.
And the other part of the physical is the manual therapy.
Obviously.
And if the physiotherapy doesn't do that, those two things, seriously, it's not called physiotherapy then. Okay. It's called, whatever. See, anyone can press that button. The guy standing outside this office can press that green and the red button. You don't need to do 4 years of
obviously,
graduation program.
And we have to see the basic physiology of the electrotherapy. What they are doing. Electrotherapy is just blocking the pain there at the peripheral site, like mostly what you call the gate theory and all these things.
But it's temporary anyway. It's shortly.
Yes,
5 days, 7 days.
They are not addressing the primary cause.
Yes.
The primary cause they are not addressing.
So there's studies.
So it's just like a steroid,
Totally. No, steroids are still good. And again, don't get me wrong. Steroids, we're not referring to athletes and doping. We're not talking about that.
You're right.
Yeah.
Steroid in general sense that what the quakes are prescribing in that sense.
Yes.
Steroid is medically good. It has to be.
There's a role for it.
Yes, certain guidelines are there. So we cannot just prescribe it just like that. Electrotherapy has a role also.
But when you limit it, initial bit when you get an injury, that's when it's needed. Not chronic cases.
No.
Yeah.
So exercise has to be there.
Yeah.
Exercise and mechanotherapy.
Optimal loading and
stuff. Optimal loading and all these things. So mechanotherapy is very important. Mechanotherapy comes from the exercise.
Yeah.
So exercise is biochemical basis for the treatment also.
So mechanotherapy, let me just actually, why don't you do that? Mechanotherapy. What does it mean by mechanotherapy?
Yeah, mechanotherapy is this the famous Karim Khan and all this Peter Bruckner. They have used this term and they have come up. They explain the biochemical basis actually. By moving the muscles and all these things, then certain ion channels are open, and because of the ion channels, there's the problem. The problem is the inflammation and all these things reduce. That means exercise is used as a treatment of the primary cause.
Right.
So this is the basis of mechanotherapy.
Right.
Like the famous example of mechanotherapy is like eccentric exercise and isometric exercise for tendinopathy.
Right.
Then the tendinopathy is a very difficult condition to treat.
Right.
Like eccentric exercise we prescribe for the patellotendinopathy, and what you call heel drop is generally prescribed. The Nordic curl is very important for hamstring. So mechanotherapy is very important. And regarding the manual therapy, what you have seen, you must be knowing better than me regarding the manual therapy. So manual therapy is also important.
Yeah, I'll just take the questions here. So there's some questions that I have here. Gagandeep Meena, there's a mild pain near sacral vertebrae. I'm running regularly. Stretching will decrease the amount of pain, but it is there. My guess, maybe due to some wrong position of sitting, sleeping. So the sacral pain, sacral pain
where? Coccyx or
right.
Near the SI joint?
Right.
The SI joint is a very complex thing.
So let's just assume it's coccyx. Okay. Because he would have used the term SI otherwise, I think. Okay. And I'm running regularly. Stretching decreases the amount of pain, but it's not enough. And is he sitting incorrectly or sleeping incorrectly?
So what type of stretching and all this thing? A little bit information is required in order.
Yeah. So just imagine generally. So imagine if there's a coccyx pain. Okay. Now, how do you suggest someone works with that?
See, coccygia, if a person is having a particular the inflammation of the coccyx, then sitting on that particular bony point, it will be painful. So for the initial phase, we can prescribe the sitting on the rubber tube, something like that. That thing, so it can be done.
Yeah.
So
you have to reduce the pressure on the coccyx.
The pressure has to be reduced, and as long as the pain has to be reduced. Until and unless pain is reduced, the muscle inhibition will be there. So all those activities which require muscles, it will be hampered by the pain. The first step of rehabilitation or anything is reduction of pain. Pain has an inhibition of the muscles.
Totally.
So pain has to be reduced.
Perfect.
So pain can be reduced by different mechanisms, like if required.
Right.
Then we can go even to the pharmacological agent also, if required.
Right.
So we have to reduce the pharmacological agent, but still,
okay,
it has to be used by.
Ankush, any other questions there? I don't see any.
No questions.
Excellent. It was actually a very long session, but it was great having Varun here because it was pretty random. He landed up, so I was like, might as well actually have him engaged. So that's it. We'll be back on Saturday 9 a.m. and we'll be talking about nucleus, general exercises and stuff. Maybe if there were a few things that I wanted to talk today, we'll just talk then. And that's it. Thanks, Varun. Thanks for coming along. All right.
Welcome.